WEBCAST is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today's Friday, July 10th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. We have several presenters for today. First, we'll hear from Bernie Simons, the Deputy Secretary for DDA. And also with us from DDA is Patricia Sestoki, Director of Programs, Valerie Roddy, Director of Fiscal and Operations, Rhonda Workman, Director of Federal Programs, Stacy Jones, Statewide Career and Employment Services Coordinator, Michelle Stevenson, a parent whose son is receiving services. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is one option for listening to the webinar, and that's by computer. We have a handout for the webinar, and it's been uploaded in the handout section in the panel to your right, and they can also be emailed upon request. We will be recording the webinar and posting it on a YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. Now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon and welcome everybody to our webinar. It's been 2 weeks since we didn't do a webinar last Friday because it was the 4th of July. I trust everyone had a long and hopefully safe and restful 4th. And as we get back into our series of webinars, as I stated 2 weeks ago, we'll be going, excuse me, every other week. So, again, I welcome everybody. We're going to talk today about retainer payments, the COVID regional updates, some issues around technology assistance opportunities, and I want to thank Michelle Stevenson as a family member going to present the perspective of her family and her son. And I think that would be a different approach that we've taken. We've had people from case management entities, providers, etc. So I think we start talking about people who are self-directing, like Michelle and her son. I think this is a good opportunity for people to hear her and his story. And so, again, our highest priority is everybody's health and safety and well-being. And then I want to thank everybody for their continued support. I would like to mention at this point in time that I want to thank the regional directors and the providers within each region who have been coming together and basically have been looking at what would reopening look like and what would those indicators be. I'm going to ask that when we continue to do this, and I believe most of the regions have had probably 2 meetings, as we continue to do this with the provider community, that we would develop some type of action plan with some metrics, and we will actually be having individual staff from the public health administration working with us to assist us. We've had the opportunities in the past to have Dr. Fetter present on these webinars. But again, as we move forward, we need to make sure that we in DDA don't have the medical background within our administration that the public health administration has. So we will be relying on our fellow administrations to assist us to make sure that we've dotted the I's and crossed the T's as we move forward. And so with that, I think we can go to the next slide. And again, I want to thank everybody. So we'll be on slide 4.
So good afternoon. This is Valerie Roddy. So I did want to touch on a few things about payments. So the first quarterly payment was issued at the beginning of this week. So providers should have seen that in their bank accounts. As I think I mentioned in previous presentations, that the first quarter payment did not include the 4% provider rate increase. Some financial decisions were still being made at the time the payment was processed. However, since then, we understand that we are now able to move forward with that 4%. So we will be processing an interim payment to providers for the difference to capture that 4% that would normally have been included in that first quarterly payment. We are still in the process of updating our rates in PCIS 2, in our invoices for those services that are required to be billed through an invoice process, and also through our cost detail sheet. As soon as all three of these have been updated, we will be notifying providers and beginning to process that interim payment. Next slide, please.
So on July 6th, I sent out a communication to the fiscal management services agencies to continue payments. There seemed to be some confusion about payments, people whose annual budgets were either missing or expired, etc. And therefore, they needed the authorization to continue. I've approved that, but I am asking everyone who is in self-direction, if there is an issue with your annual budget, that you get it into and work with your case management, CCS, and get it in by August 14th. If it's not in at that point in time, then we may have to have some discussion about people moving from the service delivery model of self-direction going back to traditional services, only because it may be more appropriate if people cannot be responsible for creating their budget and doing it, because you are the employer of record. And also in this slide, there is an attachment for those who didn't see that communication. The next slide shows that we just had our 4th round of PPE that was delivered to the regional offices at the beginning of the week. I know that we've been getting some of the PPE out. I think we've done a good job. I think we've been as responsive as we can be. We actually ask for orders from the providers to see what do they need as far as masks and gloves, etc. Recognizing that, you know, we are much better off now than when we first were with our #1 delivery that we got, but we still not be able to meet all of the needs of everybody 100%. So we will continue to strive to do that. I also want to, on the second bullet, talk about MANT. At 12 o'clock today, there was a communication that went out that I signed that said that direct support professionals do not need to be recertified by July 2020. We are going to move it out and extend it to next year, July 2021. And so there is some options there in MANT to do some e-learning, et cetera. So we will continue to do that. But, you know, as everything else with the pandemic, we are extending a lot of our, and as we get in Appendix K, we're extending a lot of our deadlines that we had in the past, and try to be much more flexible and creative. And so for the regional updates, you will see that as of yesterday, the Southern region had 211 confirmed cases. 57 were negative, 1 is pending, and we had 17 individuals pass away. In the East region, we had 29 positive, 32 negative, no pending, and no one has passed away. Central region is 138 positive, 233 have tested negative, 18 awaiting results, and we have had 15 people pass away. In the West region, we have had 21 positive, 130 people have tested negative, and 2 results, and we've had 2 people pass away. When it comes to direct support professionals, in the South region, there's been 152 staff who have tested positive. 4 of those staff have passed away. 29 in the West, 51 in the East, and in the Central region, there has been 164 staff who have tested positive, and 1 person has passed away. This is the slide that we've been showing right along on the tracking for participants in where we are. And on the left, obviously it shows the 764 people, which is about 98% of our people who have not tested positive versus the people, or the, I'm sorry, participants in the waiver versus the number of people, 2% who have tested positive. On the right-hand side, you will also see that the regions, and you will see that 2 of the regions have basically stayed flat with no increase, and that the central region and the west region have had a slight increase in the number of participants who have tested positive. On the next slide, you will see the number of people who have tested positive with the 399, and the number of people who have passed away of that 399 has been 34. And in the slide on the right is a pie chart reflecting that same information. And so since our last report, we have had 3 people pass away in one of the regions. And again, that's what that pie chart reflects. And now we're going to turn this over to Rhonda Workman to talk about retainer payments. And thank you very much.
Thank you, Bernie. So today we wanted to share some additional information that has come out from CMS related to retainer payments. And just as a reminder, the DDA's Appendix K for our waiver programs includes retainer payments that supports providers who would normally provide services to our participants, but are currently unable to due to the state of emergency. Retainer payments are time limited, and as per federal guidance, referred to and in this reference here, the State Medicaid Director's Letter, Olmstead Update number 3, are limited to lesser of 30 consecutive days, or the number of days of which a state authorized in a payment for a nursing facility bed home day. And in Maryland, under our Maryland Medicaid State Plan services, our nursing facility bed hold days are currently limited to 18 calendar days. Next slide, please. On June 30th, CMS issued some new frequently asked questions, and in that group of questions, it included retainer payments. We provided the link here so that you can refer to. They reference that state Medicaid director letter that I just mentioned that provided the guidance that we could not exceed our state nursing facility bed hold days. The guidance did not place any restriction on the number of times or time periods, sometimes referred to as episodes, of retainer payments that could be authorized for a beneficiary. So given that, while retainer payments up to 30 days may be implemented, states may authorize up to 3 30-day episodes of retainer payments for an individual during the period of the disaster using the Appendix K. So again, what they're saying in their frequently asked questions is, even though we're limited to 30 days under the Medicaid Olmstead letter, under the disaster Appendix K, states have the ability to pursue having 3 30-day periods because of the disaster. Next slide, please. States are required to describe the methodology for determining the length of time retainer payments would be used in their states under their Appendix K. And any limits on the number of episodes a state would fund need to also specify whether there will be a break in billing between episodes. The FAQs also includes clarification from CMS that consecutive days are those days that are eligible for billing. So what that means, for example, for a typical dehabilitation services, like our dehabilitation community development services that may be rendered Monday through Friday, the 30 consecutive billing days would encompass a 6-week period of time because the typical billing only occurred Monday through Friday. Next slide, please. If states choose to utilize multiple periods of retainer payments, CMS also clarifies in the FAQs that states would be required to have what they're referred to as guardrails. So some parameters and rules around those retainer payments. These are some of the guardrails that you will see noted in the FAQ. One, that limit retainer payments to a reasonable amount and ensure the recoupment if other resources, once available, are used for the same purpose. States need to also have guardrails related to retainer payments not exceeding the payment for the relevant service, so what we're currently paying if people were in services today. The state must specify that a retainer payment would be made at or the state has the option to specify that a retainer payment could be made at a percentage of the current rate, or a state may specify retainer payments will not be made to a setting until attendance is below an identified percentage. In this example, 75. For Maryland's DDA Appendix K, our meaningful day retainer payments are at 80% of the rate. So we utilize one of these methods currently. Next slide, please. Additional guardrails noted in the FAQ includes the requirement to collect an attestation from the provider acknowledging that the retainer payments are subject to recoupment if inappropriate billing or duplicate payments for services occur. Also identify in a state or federal audit or any other authorized third-party review. They noted that duplicate use of available funding streams means using more than one funding stream for the same purpose. Next slide, please. Additional guardrails that would be required include that the attestation from the provider that it will not lay off staff and will maintain wages at the existing level. Requirement that the attestation from the provider that they had not received funding from any other sources, including but not limited to unemployment benefits, small business administration loans that would exceed their revenue for the last full quarter prior to the public health emergency, or that the retainer payments at the level provided by the state would not result in the revenue exceeding that of the quarter prior to the public health emergency. Next slide, please. Additional guard rules required include if a provider had not already received revenues in excess of that pre-public health emergency level, but receipt of the retainer payment in addition to those prior sources of funding resulted in the provider exceeding that pre-public health emergency level, that any retainer payment amount in excess would be recouped. And if a provider had already received revenues in excess of that, retainer payments would not be available. Next slide. So states utilizing retainer payments for one period that is lesser of 30 consecutive days or the number of the nursing facility bedhold days in the state plan have the option of requiring the provider to comply with these guardrails. This means if we choose not to offer the full 30 days or multiple periods of days, then we don't have to require those requirements or guardrails from our providers. If we choose to have multiple periods or extend beyond our current nursing facility bedhold days of 18 days, then we will be required to implement those rules that we just shared on the previous slides. CMS also offered during their call opportunities for states to reach out and have technical assistance provided with them. The Deputy Secretary asked us to reach out, and so we contacted our Medicaid office, Tricia Roddy, to request the opportunity to receive technical assistance. And so the guidance that was requested was whether the state can implement multiple retainer payments periods giving are limited to 18 calendar days. Next slide, please. Based on the response from CMS, if we are able to provide those opportunities, funding would need to be authorized by the state. And as I mentioned, if we're doing more than one period or going up to the 30 days, those guardrails or additional rules would need to be established and implemented. Recently, Medicaid received some information from CMS that we are further discussing and reviewing with them and DBM, and we will be providing further information and updates as it becomes available related to retainer payments. Next slide, please.
Hi, everybody. Just want to shift gear for a second and tell you guys about a technical assistance opportunity that we're really excited about that's going to be made available to selected Meaningful Day providers here in Maryland. The subject matter experts that are going to be partnering with DDA on this include Cecilia Gaudolfi and John Butterworth from the Institute for Community Inclusion. And the desired outcomes of the technical assistance are for the selected providers to transform their services to support people to have meaningful days in their community and with a central focus on high quality employment outcomes. Next slide, please. The subject matter experts will be providing technical assistance for a total of 8 providers that are going to be selected over approximately an 18-month period. And this will include the development of a comprehensive strategic assessment, the development of a transformation plan, and the implementation toward those identified outcomes. There also will be some group leadership training for mid-level provider staff designed to support the implementation plan that's developed with the subject matter experts. There will also be the formation of a learning community, or otherwise known as a community of practice, for this cohort of 8 providers to learn together over the period of time. And I want to acknowledge the fact that the original work plan that we developed with ICI around this technical assistance was done prior to COVID, and it originally included a lot of in-person work at the provider site to start the technical assistance. So ICI is currently working on reformatting their TA to fit with a more remote model for the technical assistance. So we're still working out what that might look like over the course of the project. We've also talked about how to fold into the technical assistance focuses on the area of increase in remote supports for people. So whether that has to do with currently now during COVID or even moving forward, how to fold those remote supports into the business model. So let me give you a quick timeline of what we're looking for, or what we're looking at in reference to getting started. So we're hoping by August we will be able to share the official announcement and advertisement for the TA opportunity, which will be sent out to all stakeholders. It will include, we'll have an informational flyer, and we'll also hold a short informational webinar with the opportunity for providers to ask any questions they may have about the application or the application process. We are looking at the deadline for the application submissions will most likely be early September, with selections being made sometime in late September, and ultimately with a goal of a target kickoff in the month of October. So obviously the time frames that I just outlined are subject to some slight variation, but I wanted to give you all just an idea of what you can expect, and so that you're keeping an eye out for it. We're very excited about this opportunity. It's been something we've had in the works for quite a while, and it's just now coming to fruition. So keep your eye out for further announcements, more to come. Thank you.
Thank you, Stacy. I now would like to introduce Michelle Stevenson to you all, who is a family, a parent, a single parent of Brennan, who she's going to be sharing his story and a little bit about what she's been able to do and get creative and innovative during COVID-19. And then also just wanted to say Michelle has been a strong advocate, not only for her son, but for self-direction, has participated in legislative session to talk about self-direction and what it means to her and her son. So I'm very pleased to have you here join us. So Michelle?
Hi, thank you very much for this opportunity. It's greatly appreciated. Again, my name is Michelle, and I am Brennan's mom. And Brennan has started self-directed service in July 2017 when he transitioned from his homeschool in our community. Self-directed service has definitely been the best choice for Brennan and our family. As many of us know as families, there are many people who are on the team and they are listed on the sheet, on the slide. And we have been exceptionally grateful to everyone that has participated on our team. I like to say we have many people on our bus. I'm the driver and I have many people on board, and it is truly about Brennan and his person-centered plan. Every day is a new day as a parent, and you make the best of it. And during COVID-19, we've all experienced many challenges, whether it's from anxiety, and next slide, sorry about that. So next slide. Can you go to the next slide? Yeah, thank you. We've experienced many challenges, from anxiety to the obsessive compulsive behaviors to disruption of routines, not participating in the community or volunteering. And I'm sure many families can relate to those experiences. We have a talented team in place of direct support professionals. And although we've had to downsize our staff due to safety protocols, we've been able to, for the most part, keep our routines in place with some modifications. We've had to reassess and restructure during COVID-19, but the main objective has been to keep those goals and objectives in place within the home. Community development, we've been able to bring some of those skills back into the home to continue to teach those. So when Brennan is able to go back out into the community, those skills will be enhanced and we can apply them back out into the volunteering, community development service opportunity. We have accomplished using a lot of visual supports. As if you can see, he has assistive technology. He's nonverbal, hearing impaired, autism, and visually impaired as well. So we have to do a lot of visual support. We've had a COVID checklist. Actually, you can go to the next slide. If you look, it says Governor Hogan says stay home and be safe. That was what we've taught Brennan to type on his device. And he is extremely a natural at that now, and that has been our go-to lingo for him. Governor Hogan says, stay safe and at home, which has been very challenging for him. Next slide, please. These are some of the visual supports that we've created. So we have B's COVID checklist that you can read 1 through 10. We read that to him every day to provide some new structure and routine and to alleviate some of that anxiety that he is experiencing. We have an unavailable and available topic board for him. As you can see, he has many activities that are available to him and things that are not. It took us almost 2 months for him to realize that the things that he enjoys so much, a part of his person-centered plan, are not available to him anymore. And I am most grateful as a mom to have our direct support professionals to be able to implement these changes in his daily life. They are trained, we collaborate, we communicate, we need to make changes daily. And this has been extremely difficult with the COVID-19. But I can say it to this date, he has accepted it. He's shining, he's making a lot of progress. So again, these are our checklists, things that are available that he can do and things that are unavailable that he cannot do. And hopefully in time, he'll be able to return to his daily schedule. Next slide, please. This is another, some visual supports. He has a time chart, so that would help alleviate some of knowing a part of his day, how we've restructured of spending more time at home and staying safe and providing activities within the home to meet those community development service skills and also the personal supports. We've had to be creative. We've done a lot of new stations and activities within the home and outdoors in our yard. So we've done the time chart to take some of that anxiety away, and also some calming techniques such as the deep breathing, safe hands, counting to 10, just for him to understand that it's okay, this is why we're staying home, and the reasons we would revert back to the COVID-19 checklist to let him know why we're staying home. And then another important tool that's very successful that I'm sure families have used is the now, next, and later. He would have a schedule board within a location in the home that is changed throughout his day for the now, next, and later. So that's an example that I have provided for him. And also first and then is very key as well. You know, when Brennan would start typing that he was going to the ocean, he did not understand why that was not occurring when he wanted to go. So we've had to do a calendar and implement and let him know that this is not happening now, but perhaps in a later month that we would be able to do that. Next slide, please. These are just a few of the things that we have created in the home and outside. We've for the outside activities, we made a topic board, and throughout the yard, we had different stations, a picnic table, a circle table. So he would actually have different items on the table, and he would follow his schedule board and transition to those various activities. So basically, it looks like a grand field day for him to participate with other activities that we could not do out in the community. Turn taking is one of his person-centered goals, and learning to play a game and waiting and taking a turn. Fine motor skills are involved in that as well. So we have been working very hard, I should say actually his direct support workers have been very hard learning to play a game with him. Teaching community skills at our office. We have a family business, which is we've been blessed to have. So we've been able to implement our community development skills within our family business where he could go during the day. So this is an activity. Brennan loves to grocery shop. At Giant, they call him the mayor, and they have greatly missed him. So we have taken some of our items on the shelf and have done a list or a math skill or identifying. And so we have taken these skills within the home and that he can incorporate back when he goes out into his community grocery store. Lots of us love gardens, so we planted a herb garden and a wildflower garden for him that he needs to learn to identify each herb or flower, learn to spell them on his device to be able to communicate, and also to maintain and take care of, and to see if there's any tomatoes that we can use, you know, within his meals. We did a lot of typing. He has a touch monitor screen. This is Brennan's strength. He can type and he spells very well, being nonverbal. And we went to neighbors and staff workers, and we delivered safely his kindness letters. He may deliver flowers or a little letter, and this was an example of one of the letters that he typed with some visual prompting and delivered it. So then we like to end our day. We are fortunate in our community to have a community beach. So since he didn't get to go to the ocean, as a motivator and reward, he would like to end his day for a break choice, going to the community beach. Again, self-directed service model is a top-notch program. We have been blessed to work with MDH, DDA, our CCS. We have an exceptional team that is trained and collaborates and works with Brennan daily. So our experiences, I am grateful as a mom that 3 of our staff has been consistent during the COVID pandemic, that they have come in daily, and we have not had that disruption that I'm sure other families may have had. So that has been a positive for Brennan and for myself. I like to just acknowledge our workers. We have Kim and Kelly and Miss G and Tony and Erica and Kristen and Kathy and Greg, who have been on board. It is very challenging to find staffing and who are trained And we have been very fortunate to advocate and to have that team in place to cohesively come together and meet all his goals and objectives in his person-centered plan. So I want to thank you for this opportunity, for allowing us to share about our program and some of the challenges that we've had. I can say one thing that I'm concerned about is the masks. Being sensory and hearing impaired and nonverbal, we've been practicing wearing the mask, so when it's time to go out in the community, you know, he will be able to participate. It's difficult coming from a parent's perspective and implementing that on his schedule and trying to teach him to do that. And when you're hearing impaired, visually impaired, and nonverbal, and the staff is wearing their masks, you know, they need to lean in closely and vice versa. So I'm sure, again, many families will have this experience that they will deal with as well. And I wish everybody luck on that. And hopefully our adults will be back in the community and enjoying recreation and leisure, volunteering, or back in the community working. So thank you again.
Michelle, thank you so much for sharing your experience, and it sounds like you have an awesome team, and thank you on behalf of the DDA to your direct support professionals. I think that you speak very clearly of our demand of DSPs and the work that they have done so diligently and so well during this last 3 months and ongoing. So, and thank you for sharing the different ways that you've created some creativity, innovation in making sure that Brennan continues to be a part of his daily life and trajectory to his good life. So thank you for joining us today. Really do appreciate it.
Thank you very much for the opportunity.
Sure, thank you. So the DDA, as you know, we are going to continue to be able to share with you any information or any resources that come up. We will continue to collaborate and advocate on behalf of the people that we support and families and staff. And we will help Marylanders with intellectual and developmental disabilities thrive. And that is our goal. Our goal is to make sure that as we get local, national information, that it would enhance our purpose and our mission, that we will update and share that with you. So thank you for joining us today. I am now going to turn it over to questions. So Rhonda, can you open up the question box and let me know if there's any questions on there?
Sure, absolutely. Valerie, we have some questions related to some of the information you shared. First question is the first payment include the shared hours from March through June in residential?
No, the quarterly payment only included those hours that were captured January through the end of March. So in terms of the shared hours that were a result of the flexibilities in Appendix K, so we're really talking about probably the last maybe 10 or 12 operating days.
Okay, it looks like we had several that were similar to that. There's a question that some staff working with personal supports clients are requesting PPE. Can DDA review its position on that?
So I think there's going to be some additional information coming out about PPE in the near future that may address that question.
I would encourage the folks, whether they're in personal supports, residential day programs, to really reach out to the regions. They know the number of PPEs that they have, and they also can provide you with some support and assistance. I would encourage you guys to communicate, because I know that some of you were completing the form that the regions use, but we also are able to share additional PPE based on availability.
Valerie, there's another question. Will the 4% interim payment be given out to provider in this month?
No. And when I say that, what I mean is it takes us at least 3 weeks to go, for the payment to go through the state process. So as I mentioned when I spoke about the bullet points on the slide, we are still in the process of updating our IT system with the rates, and we also have to update the invoices, and we also want to update the cost detail, which doesn't really relate directly to the payment, but rather to planning. Once all of that has been done, and we hope to have that done probably in the next week or so, we will then be able to begin the process for the payment, including the 4% for the first quarter. So we really anticipate that by the time we do all the things that we need to do in DDA, taking of all the steps, getting the file together that we will then use to go through the state process, it'll probably be more like August when providers will actually see the payment.
Thank you, Valerie. We have a few questions related to the retainer payments. The first one is, residential providers who provide day services during COVID are not receiving retainer payments, so these rules should not apply, is the question. And the answer to that question is you're correct. If you're providing services, then you would not submit a claim for retainer payments. Retainer payment claims are submitted in the attendance only when the provider is not providing the services. The next question related to retainer payments is, if you're able to provide multiple periods of retainer days, would we be able to modify our billing for April, May, and June? So I would say once a decision is made, if we're able to provide multiple days of retainer payments or change anything related to our retainer payments, we will provide guidance out to our stakeholders to include steps and processes related to billing. Valerie, did you want to add anything related to the April, May, and June billing question?
No, I think that's accurate. First, we have to wait to see if there are any changes, and then we've got to then we can issue the guidance on how we could handle that.
Thanks, Valerie. I have a question for Stacy. Will the technical assistance support include analysis and recommendations on how to run a profitable community-based day program?
Yes, so the subject matter experts will be working directly with each provider individually to come up with an implementation plan. So if that's part of the organizational plan and the outcomes, then yes, absolutely, that would be part of the TA.
Okay, and can you talk a bit more about how the technical support initiative with ICI intends to support the providers with employment outcomes?
Sure. So again, the subject matter experts are going to be working directly with the organization. So it will include the executive director. It will include probably the board of directors, various levels of staff throughout the organization. And the subject matter experts, along with the staff from the organization, will create an implementation plan. They'll create outcomes that are desired. And as I mentioned, really the desired outcomes are an organization that's focused on the people being supported to have meaningful days in the community and high quality, competitive, integrated employment outcomes. So the subject matter experts really need to first help the provider do an assessment of what needs to be accomplished. So it's going to be very different for each organization, depending on where you are in your transformation efforts, what processes you already have in place. So it's going to be tailored individually to each of those 8 providers. So it's really going to be dependent on those things. And as soon as we have more of an idea of what the 12 to 18 months are going to look like as far as a work plan, we'll be able to share that information.
Thank you, Stacy. I just have some comments. Share that, Michelle, this is great information and ideas. Thank you for sharing. Wonderful presentation by Michelle Stevenson. Self-direction is a full-time job. Thank you for sharing a real person's story and success.
Thank you very much. Appreciate that.
Let me see if there's any questions for you. No, this question is for Bernie. Is What will happen is self-directed participants completed the annual PCP and budget for F21 with CCSs, but the CCS provider has failed to submit these documents by the DDA. That's a great question. We are actually working, we just had a meeting with all of our leadership, the regional directors, to really track this very closely and provide support and technical assistance. We consider everybody in self-direction, whether it's the FMS, the CCS, support broker, the regional offices, are part of the team to make sure that we meet this time frame. So we want to make sure that we're working very closely with that. Bernie, do you want to add anything to that?
Well, I think if you reflect back on the slide, I said may have to go from self-directed services to traditional services. I mean, I think that the issue is if the individual participant and family who are self-directing have done their part, and you can't turn around and say, well, you can't stay in those services if it's somebody else's responsibility. So it's a case-by-case basis as the bottom line. I just want to encourage everybody to make sure that all of their budgets are done and in, so that we're not running on a wing and a prayer here with hopefully these budgets will come in if they're either overextended or expired. So I'm just asking for everybody's cooperation.
Thank you, Bernie. Michelle, some people wanted to know, what does CDS stand for in teaching CDS skills at office when you present it?
Yeah, absolutely, sure. So, so it's the community development services or community learning. So basically we have a family business. So Brennan goes there daily with myself and his direct professional worker, and he can do collating jobs, so simple office tasks such as collating, sorting, stocking, labeling. So we have basically, as a team, have set up some skills within the office that he can, contribute in his community and to our business. And he has been able to continue to go there. So it would be simple office tasks that we have set a program up for him to do.
Thank you, Michelle.
Sure.
And go ahead.
And he does volunteer at 2 churches and 2 schools. So, and he misses those locations greatly. So what we've done is to keep that routine and structure for him. We've tried to bring those skills within the location of our home to be able to continue working on those skills. So when we go back into those locations in the future, he hasn't lost or regressed in doing those things that he did on a regular basis. So really it's bringing the community into the home. But I also say there's many opportunities to teach those skills that can be applied within the community, from the home to the community.
Thank you, Michelle. Rhonda, I'm asking you this one just because it may deal with some waiver. Can a CCS be a self-directed support staff off the clock and hired by the self-directed person?
So that's a great question, and one of the things that we have to be cautious of is the federal requirement for conflict-free case management. And so if their coordinator of community services is providing case management services to a participant, there would be a conflict for them providing direct support for the individual.
Thank you. Valerie, this is for you. And it has to do with the roadmap that we sent out a couple of weeks ago, last week. The DDA roadmap states that personal supports and electronic verification visits guidance should start coming out in July. Do you have a day when this will be out?
That's a good question, and we are working on it. We had a meeting with the LTSS provider work group earlier this week where we shared policies and talked about the process, and we got really good feedback from that group. So we'll be working on finalizing these policies and some of the guidance, and probably I would say I'm working with Patricia and her team as well, probably later this month but we are trying to get them out as soon as possible. Patricia, did you want to add anything about the timeline?
No, I think when we get it out, people can see it. I don't want to get ahead of ourselves.
Right, and we are finalizing. We're working on it, so it will be coming out soon.
Good. This one is for either Valerie or Bernie, and it has to do with retainer. The comment is Rhonda did a great job walking through the possibilities of retainers. But really, what is DDA's position in moving forward pursuing this multiple retainers?
So I think one of the issues is that you need to recognize that, we would like to, in DDA, move forward with this, recognizing that, the state has got significant problems with the budget. You saw that there was a cut in the budget in millions of dollars at the Board of Public Works last meeting, and that I'm a little concerned, and was in the slide on the retainer, that this is not just DDA. This is with retainer days. This is DDA. We have to deal with Medicaid. Medicaid has multiple programs, not just R3 waivers in the DD administration that it may affect, and as a result of that, also there is always the state match that we need to have on the front end to draw down federal money. And so obviously this is not just going to be 100% Fed money coming in to the state. So this needs to be a lot of conversations. We are advocating for this. We've said this on multiple webinars that we're advocating for the retainer days. I think we were surprised that we went from 30 that we requested that was in the application, and when it came back, it was tied to the nursing home bed hold days. So that's been our position. Thank you.
Thank you, Bernie. Rhonda, can you explain a little bit more about the PPE? Can PPE costs be added to a self-directed services budget using funds already in the budget?
Yes, absolutely. That's a great question. And the answer is yes. PPE can be added. We do have some information and guidance on our website related to Appendix K and memo for self-directed individuals. But yes, you can use your funds to purchase PPE utilizing the individual and family directed goods and services.
And this one, it's really a question for Valerie and Rhonda, but it's how will the higher isolation daily rate in residential services be paid and when?
So let me talk about it. So we added the hours. I think if we go back and think about the guidance, we added hours to each home based on how many people were in the home and an estimate of how many hours of support would be needed in that home. That was added. So as providers bill for those people, as they certify their attendance, that rate is already built in. Those additional hours are already associated with that person, for example, in that home. So it will come through the normal payment process.
So I would add to Valerie's comment, because I think, Patricia, the question was the higher isolation daily rate.
Oh, isolation, not additional hours. I'm sorry.
Yeah.
I apologize. So isolation, again, is the same thing. When providers input their attendance and certify their attendance, there is a calendar to indicate, or you can indicate in there, if it's residential, for example, a particular code. And I would recommend that you look at the guidance that was provided, because it gives very specific information on how to ensure that you record the isolation day, and so you can be paid for that isolation day.
And I would just add that this week we updated that guidance to clarify that those isolation days are available for a maximum of 21 days total. So you'll see a revision to that that's already posted and live on the website.
Thank you, ladies. This one is, are providers now required to approve PCPs and LTSS?
Yes.
Okay, I'm just going through. Let me just go through. This is a Valerie question. Do we have a sense of how much of last year's budget went unspent? If you modify the retainer days, will funding for day prior to July 1st apply to FY20, last fiscal year?
So I think there's an assumption that there is a surplus. We are still working on, and we're just now starting our year-end closing, so we will have a better idea in about another 30 days. But at this point, I mean, we do not anticipate a surplus at this point in time. We hope it's something different, but right now, given the fact that we've had additional cost relative to, for example, we just talked about isolation days, and then I mentioned erroneously, but still, it's in a cost, additional support within the residential homes during this time period. So the assumption that there is a surplus may not be real, but we should know better in about 30 days when we finish closeout.
And Valerie, there's a couple of questions about EVV. I didn't know if you wanted to wait till the next presentation, but one of them is, it says, will CCS initiate the EVV process for personal supports providers?
I'm not sure exactly what they mean by initiate, but we will be, the one thing that CCSs will be doing is assisting with the distribution of the tokens that will need to be given to people receiving personal support services.
All right, thank you, Valerie. I don't see any other questions in the chat box, so I'm going to turn this over to Bernie, and then we would end. Bernie?
Well, again, I want to thank everybody for being on the webinar today. Hopefully, as we continue to think about what we do with retainer days, Valerie and her group working on pushing the 4% out in August, and continuing to collaborate. And I would ask if people are interested in specific topics to address on these webinars, if you would send those to Patricia Sestoki, so that we obviously have some conversations to figure out what we are, what is the interest, what do we look like, different elements of our administration, whether it be like the great presentation that was done today on self-direction by Michelle, or the providers who presented a few weeks ago, or the case management, etc. So obviously, we want to make sure that in times of this pandemic that we are as responsive as possible. And again, though, there might be a topic that is of interest to quite a few people that we can address on these webinars. So again, thank you and be safe.
Thank you. Bye-bye.